Hey guys, it's Matthew here at Dr. Jason Emer's office. We have a female patient, that just got beautiful high definition liposuction along with a revision tummy tuck. So our patient did have surgery previously. We can see her before. She has a little unevenness here, and obviously the previous scar, which was thickening. And so what we did was we did a whole contouring HD-Lipo, and then the partial tummy tuck. And then we also did a fat transfer to the breasts bilaterally, so both of them. She had a slightly indented nipple on one side, so they were able to actually do micro nano fat transfer. So that's when they do small droplets of fat just to correct those small minor imperfections. She also had fat transfer to the glutes. I mean, look at this, you guys. Look at the detail here. And this is her pre-operative photo. We can see, you know, the slight dimpling, the irregular texture here. And if you look at the after, look how smooth. Our massage therapist is just massaging the fluid right now and kind of pushing it and migrating it towards the drains so that kind of exits. And just look at the tapering here. Look at the shape. The breasts are here that, you know, were obviously filled with a little bit of fat that was transferred. And just look at the contouring. This is, again, just 1 day post-op. She's also getting an IV infusion to help restore and speed up that healing process. So NAD Plus is one of our more popular infusions that we do, and that helps with regenerative properties in all your cells from head to toe. So it's great to do after surgery. And I mean, we can see again, look at here. I mean, that's where her hip bone is, and we've created a little creative curve, the Emerage bell-shaped curve, and maintaining that tight athletic structure. Our patient's very athletic, she works out, and now her body reflects that lifestyle because you can see how tight and beautiful that is. And again, it's just 1 day post-op.
They're saying she looks amazing. Her skin looks much more tighter than before. They want to know how many massages do you need after this?
So we have a custom regimen for each patient, but to give you a range, you do anywhere from 7 to 14 sessions, sometimes longer, depending on what you need. The lymphatic massage doesn't only help with moving that fluid, it helps avoid scar tissue formation, which is a common thing. We also have radio frequency, our oxygen chamber, and obviously our IVs. So those kind of work hand in hand with repairing the body after surgery and preventing, scar tissue buildup.
And they want to know, when can she work out again?
She can work out soon. She won't be able to do heavy weights, but we say give it around 2 weeks or so to kind of give the body to repair itself. And obviously it depends on your procedure. So if you have more incisions and more cuts, you obviously want to wait on that. But as you can see, she's got a running start. As soon as she's ready to work out, look at the physique we have here.
Do any of your treatments help with stretch marks?
Yes, they do. So in doing tummy tucks, whether it's a mini or a full, we are removing some skin. Now with stretch marks, if they're linear, it is a little bit more difficult, but in surgical operations, they can actually shorten that stretch mark. We also have, medical tattooing available. So we can actually tattoo those areas to blend in with the natural skin tone. So depending on your scarring and stretch marks, we can definitely address those accordingly.
Can this be done on men?
Yes, these can be done on men. So stretch marks are not unique to just women or just men. So we can definitely help and address those concerns.
Where can I get a lymphatic massage?
Lymphatic massage, you can get it through our office, whether you had surgery or not. We can definitely help with that post-op care and assist you with getting that organized.
They want to know, can this result happen with someone in their 60s?
Of course. Now, obviously, the skin laxity and the skin texture is a little different, but the results are similar in that we are reducing the amount of skin and reducing that and creating a little bit more of a smooth look. So look again at this before. I mean, look at that. And then there's obviously additional volume that was lipoed out. And then more high definition areas, which are kind of going to be more exaggerated to kind of give that physique and athletic look that our patient already has in her lifestyle. But now it's reflected in her body. I mean, look at the curve here. Look at the skin texture. I mean, it's very smooth. It's not too tight. I mean, it still has some laxity here that we
barely
want.
Grab it all.
Exactly. No
Can't
fat.
grab, no fat.
Yes, exactly. So there it is, folks. And she's getting the IV infusion. So It is being infused slowly as NAD is traditionally done. And she's going to be here for the next week or two and getting those post-op procedures to help her speed up that healing process.
A couple more questions. If you have a tummy tuck already, do you go through the same incision or do you make a new one?
So the surgeon will decide. Usually he goes through the same incision, or if there's going to be excess skin, he may revise the entire area and go a little bit more above. But in this case, he did go through the same incision, but brought it a little lower to pull a little bit more skin down. So it is customized depending on the surgeon who works with Dr. Emer, and they together decide on the approach that they're going to take. So here we see that she had a pretty low scar, and now when she wears a bathing suit, it's not even going to be visible. With our laser treatments, hyperbaric oxygen, lymphatics, and IVs, this is bound to be so minimal and, very naked to the eye, barely seen. So with laser treatments, we actually, as you can see, it's a dark scar. With some laser treatments, we're able to resurface this and actually lighten that pigment to match her natural skin tone. So with regards to scarring, it's the surgery and the post-care.
All right, guys. Thanks.